With a new school year now underway across the country, it's important to not only focus, of course, on your kids' physical health, but also their mental health. Concern was already on the rise, but only made worse by the COVID-19 pandemic.
And joining us now is a man who is working hard to raise awareness on this important issue, United States Surgeon General Dr. Vivek Murthy. Welcome back to GMA3. It's great to have you with us today.
Thank you so much.
I do want to start on a recent headline. You know, while conceding we, quote, still have a problem with COVID, President Biden recently said the pandemic is over. As the nation's top doctor, do you agree? Is the pandemic over?
Well, here's where we are. We've made tremendous progress in the pandemic. You know, our number of deaths and hospitalizations are dramatically lower than where they were in the early stages of this pandemic. And that's good news. And we've arrived at that point in part because we have a lot of immunity in the population, thanks to people taking vaccines. We've got good treatments now, like Paxlovid. But our work isn't done yet. And this is something the president mentioned as well, that we're still working on COVID. We have work to do. We want, for example, people to go out and get the updated vaccine that is now available for anyone who's 12 and up and who's been vaccinated more than 2 months ago. It'll help not only protect you from COVID that's circulating now, but also there may be a winter surge that comes. We've seen that the last 2 years. Getting protected is with that vaccine is the best thing you can do to keep yourself and the people around you safe.
And Dr. Murthy, I know that a lot of parents are thinking about this. You've really prioritized this issue of mental health among young people. And I know you wrote this great USA Today op-ed that everybody should check out right now for the tips. But tell us, you also wrote this, you released the Surgeon General's advisory on this late last year because you see it as that important. Why is this issue so important to you?
Well, Gio, this is a very personal issue for me. I'm a Surgeon General, I'm a doctor, but I'm a dad, first and foremost, and I have a 4- and 6-year-old. And I watched as they went through the pandemic, and I saw how it impacted them. My wife and I worried about them a lot during the pandemic, and we're not alone. But even before the pandemic, I should say that our kids were really struggling. In the decade prior to the pandemic, there was a 57% increase in the suicide rate among young people. Right now, nearly half of high school students in America say that they feel persistently sad or hopeless, and it takes 11 years on average from when a child has symptoms to when they can get help. This is not acceptable. We have to change that. That's why I issued the advisory last year on youth mental health to call our country to action and to lay out a clear set of plans that we need to enact in order to take care of our kids.
And you've been open at times about really needing help. So what can you tell us about your own experiences and dealing with this and what people can learn from this, from the top doctor in the country?
Yeah, well, like so many people, I have also struggled with mental health, especially early in life as a child, and at times later on, as an adult as well. It's part of the human experience, and it's very important that we recognize it's not a source of shame. And one of the things I laid out in the piece that I wrote today was that it's important for parents to understand a few things. One is what to look for if they're worried about their children. If you notice that your kids, for example, are having difficulty sleeping or have changes in their dietary pattern, if they're withdrawing or starting to have more fights with their friends and family members, if their performance in school is suffering or they're having trouble concentrating, these all could be signs that your kid is having a hard time. So I lay out a number of steps that we can take as parents. One of the most important ones I want to highlight is the importance of opening up a conversation with your child about mental health, asking them how they're doing, listening without judgment, making sure that we're sharing our own experiences, but also reminding them it's okay to ask for help. And there is help available. I don't want parents to feel they have to do this alone. We have 988 stood up. That's a crisis line that you can call. Many schools now have counselors, and we've worked hard in the administration to put billions into schools so that they can actually get more mental health services for their children.
The new year, the new school year is a good time to maybe start some new practices. You've laid out some things there. I think all parents struggle with how to start that conversation, right? How to make sure that your child really is, doing well and getting the care and services that they need. How do you sort of begin that?
Yeah, and I can understand, especially for parents who didn't have that conversation with their parents when they were young, it can be tricky to figure out how to do this. But one thing I'll say is that just simply starting the conversation by asking your kids how they are doing, how they are feeling, giving them some language just by describing your own feelings and maybe your own struggles, that can help immensely. And then the listening part is so important. It's not always about what happens in that first conversation. It's about signaling to your child that you are there for them when they have troubles. And finally, just remember this. I want to say to all the parents out there, this has been a really tough 2 years. It wasn't like parenting was easy before the pandemic, but the pandemic has made it just so much harder. And for parents out there who might be feeling, hey, I'm not doing a good job, shouldn't I be doing more for my kids? Just know that you're not alone. A lot of parents, are having a tough time, but there are resources there for you. And when I struggle as a parent, when I feel overwhelmed, and I do feel that at times as a parent, here's what I just try to remember. The most important thing we can do for our children is to make sure that they know that they are unconditionally loved. At a time where so many kids feel alone, unseen, and like they don't have worth and value, making a child feel seen and understood and loved is one of the most profound sources of healing we can provide them.
And as you note, we are all in this together as parents.
Yes, absolutely.
Dr. Murthy, thank you so much. The United States Surgeon General right here. And of course, a reminder to our viewers, if you or someone you care about is experiencing suicidal thoughts, substance abuse, or other mental health crises, please, please, please call or text that number right there on your screen. It's the new 3-digit code 988. You will reach a trained crisis counselor for free, 24 hours a day, 7 days a week. You can also go to 988lifeline.org to chat with some right now. Thank you again, Doctor.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.